Vice Provost and Dean of Student Affairs. So happy to be with you today. And I just want to make a note that I will probably be leaving the call just a few minutes early. And I just wanted to make note of that, but you have several people on the call that will be able to address your questions. So thank you and welcome.
Hello all, I'm Karen Barris, Vice Provost and Dean of Academic Affairs.
Good morning, I'm Dean Michael Kelly. I'm the Dean of Design and Production. Welcome.
Hello everyone, I'm Kayron Lance. I'm the Administrative Manager for the School of Drama.
Hello everybody, I am Deborah Levine and I am the Dean of the School of Filmmaking.
Greetings, I'm glad that you can join us today. My name is David Winkleman and I serve as Associate Dean in the School of Music.
Oh, I'll interject for a second. Endelyn, I believe you're next, but you're muted. You may want to unmute and then reintroduce yourself.
Good afternoon, everyone. My name is Endelyn Taylor, and I'm the Dean of the School of Dance.
Hello, everyone. My name is Martine Green Rogers. My pronouns are she, her, hers, and I'm the Interim Dean of the Division of Liberal Arts.
Welcome, folks. I'm Martin Farrell. I'm the Dean of High School Academics.
Hi, everyone. I'm Sharon Summer, and I'm the Director for Student Health Services.
I'm Laurel Donnelly, and Director for High School Life and Case Manager on.
Hey, everyone. My name is Steve Gallagher. I work in the Office of the Dean of Student Affairs.
All right, well, let's go ahead and get started. Welcome, everyone. We are very excited to be on the cusp of welcoming our returning students back to campus for the fall and welcoming many others of you for the first time as you join the Fighting Pickles as a new student. I also want to welcome all the parents and guardians who are able to join us today. It is a really exciting time to be at UNCSA with so many big things that are underway and many others that are on the horizon. That being said, we are coming out of the absolutely most challenging year in the history of our institution, something that pretty much all other colleges and universities would agree on. And I know for so many of you and your families, last year was also possibly the most challenging year that you can remember. I'm very proud of this community, though. Even in the midst of last year's unique challenges and the threat of COVID-19, the students and faculty in this campus created an extraordinary amount of art in traditional and many new and innovative ways, and they continued to share it with the world. I want to express my deep gratitude to our returning students for just an immense resolve and spirit that they showed over the past 18 months, our incredible faculty that worked alongside and guided them, and our truly dedicated staff that supported our faculty and students throughout it all. The pandemic is certainly not behind us, but we are in a much better place today than we were a year ago. While there are new developments with the Delta variant that we continue to monitor and respond to, this is a pandemic that we have all been dealing with now for about 18 months. And we've learned so much since March of 2020. And despite many challenging moments, we have had a lot of success in keeping this campus and its people safe, more success than many other institutions have had. And so we are taking a similar approach to health and safety for the coming fall semester as we did for last year, and using most of the same tools as before in our efforts to mitigate the risk of COVID-19 on campus. Of course, we have a few very important tools now that we did not have a year ago as we began our school year: vaccines, which reduce the chance of severe illness from COVID-19 to close to zero, including the Delta variant. The absolute best protection that anyone can have against COVID-19 is to be fully vaccinated. And I personally hope that you all are, but if not, I strongly encourage you to do so right away. I read a report over the weekend that the national vaccination rate rose about 30% last week after waning over the course of the summer, which is very encouraging to see. And I hope that continues and that the rate grows even further. As we have all been learning over the past weeks, the Delta variant is something that demands our close attention. It has been proven to be more contagious than the previous variants, as well as more harmful to unvaccinated people. As of July 22nd, nationally, over 97% of people hospitalized from COVID-19 are people that have not been vaccinated. Breakthrough infections is a topic that is very much in discussion now. Breakthrough infections are when a person that has had a vaccination still becomes infected by a virus. They have always been a common occurrence with viruses and vaccines, and now have been proven to also be happening with some that have been vaccinated against COVID-19. Reports in the past week of possible breakthrough infections were what prompted us to revise our initial masking protocols a week ago, which we did even before the CDC announced their revised masking guidance for the country. However, it is important to note that breakthrough infections from COVID-19 are still very rare, and studies have recently been published showing that vaccines remain effective in preventing infection and highly effective in preventing serious illness or death. The most important and most often referenced to these studies is from July 22nd in the New England Journal of Medicine, still 88% effective in preventing symptomatic disease from the Delta variant. But it is a variant, and there will likely be other variants. UNCSA continues to plan for a more typical academic year than we had last year. We will continuously monitor the evolving COVID-19 situation, as well as stay closely attuned to vaccination rates on campus and in the country. And more about that in just a moment. Our revised community health standards follow recent updates from the state and the CDC. We are constantly monitoring their guidance as well as the guidance from local health officials, and will adjust our health and safety protocols as needed. We'll go into this in more detail in a bit, but the most important elements of those protocols are wearing your mask when indoors and frequently washing your hands. We cannot overstate how effective those two things are and have consistently proven to be in mitigating the risk of COVID-19. But as I mentioned earlier, there is no greater protection that you can give yourself than to get vaccinated. Getting your shots and following these protocols will keep you safe. And we expect every person on campus to exercise the highest level of personal responsibility in protecting themselves and protecting the others around them. The protocols and policies we are outlining today are not suggestions. They are required by everyone. It is important that everyone also be responsible for staying up to date with the communications and the information that we're sharing today and everything going forward. Throughout last year, UNCSA maintained an online dashboard on our website that posted our COVID-19 case numbers. And we resumed this dashboard on July 19th to update our community with any case numbers on a daily basis. And we will continue with Monday through Friday daily updates to that dashboard until the information is no longer needed. And as of today's dashboard update, we have no active COVID-19 cases on our campus. So now I'm going to go through a few topics that are of the most importance, and along the way address as many of the pre-submitted questions as we can. And we'll have some time later for others. I'm going to go through some topics of vaccinations, masking policy, and testing. And then I'll invite Provost Patrick Sims and some members of his team to go over some student and residential life topics, as well as some of the specific arts and academic planning that he has been working on with our deans. And then with the balance of the time, we'll have space for many follow-up questions or new questions as we can through the Q&A tool that Claire mentioned at the top of the meeting. So first, regarding vaccinations. In late spring and through the summer, we ran multiple polls to try and gauge how many members of our campus have been vaccinated. And through those polls, we heard from nearly half of our campus. Of those that responded to the polls, we heard that 87% of faculty, staff, and returning students were vaccinated, and 91% of incoming new students have been vaccinated. Both polls had a high response rate, and statistically they represented an accurate projection for our campus community. But it's important to note that this is still simply a projection, one based on the data that we have had available to us up to this point. Going forward, what we need now is a concrete percentage of vaccinations on campus, and that is what we have been moving towards and will have soon. Within current state and UNC system policy, the only way we'll have accurate data about the percentage of our campus vaccinated is through the voluntary upload of the proof of vaccination through the link which we shared with students last week. Every person on campus, students, faculty, and staff, is required to choose one action, which is to either submit a negative reentry test, which is something that we also required on campus last January, or choose instead to upload their proof of vaccination. Students who do not submit proof of vaccination or a negative COVID test will not be allowed to move into the residence halls, nor have their one-card IDs enabled in order to access campus facilities. To And to maintain anonymity, vaccination proof records are managed only by Clarice Davis, who is the UNCSA Emergency Management Coordinator. The only people that will have access to those records will be Clarice, the executive leadership team, and the director of health services, which will be only to maintain our campus vaccination statistics and when there is a need to verify vaccination due to potential exposure or to be able to opt out of our surveillance testing process. Once the submission deadlines have passed, we are going to be able to have an accurate vaccination percentage for the entire campus, and that is a data point that we will share with everyone. As announced previously, the deadline for new and returning high school students is August 4th to upload proof of vaccination, meaning both doses of Pfizer or Moderna vaccine or a Johnson & Johnson one-shot vaccine. Otherwise, you are required to submit a negative test by Monday, August 9th. The deadline for all new and returning college students is August 10th to upload proof of vaccination. Otherwise, you are required to submit a negative test by Monday, August 16th. And these are dates that were in the email that we've already sent you and had reminders. In both cases, if you are still in the process of a 2-shot vaccination, then you'll still need to submit a negative test by the deadline and then share your vaccination card once you do get your second shot. Some of you have inquired why we have not required vaccinations for all UNC students at UNCSA. The answer is that at the moment, the 17 institutions of the UNC system are not permitted to mandate COVID-19 vaccines. The guidance that we received from the UNC system office is that public institutions could not require vaccination of students unless the North Carolina Public Health Commission added the COVID-19 vaccinations to their list of required vaccinations, which to date it has not yet done. The reason that was given by the commission was that the vaccines are still under FDA emergency use approval. There exists the possibility that the North Carolina Public Health Commission's decision could change once the FDA has given the vaccine's final approval, which I have read that the FDA could potentially do as early as late August or September. But that is something that we currently do not know, and we will have to wait and see. There have also been questions about recent developments with the legal ruling that we've read about in the media for Indiana University, which upheld the constitutionality of IU's vaccine mandate. It is anticipated that that case will now go to the Supreme Court. It does not currently change the situation for the state of North Carolina for the reason that I mentioned earlier. I've also received questions about why Wake Forest or Duke, among others, can have a vaccine mandate. And that is, of course, because they are private institutions and are not subject to the same public policy as the UNC system schools. If the guidance we are given by the state and or the UNC system changes, then we would be ready to respond as an institution. In the event that we did end up having a vaccine mandate at some point, the kinds of existing medical exceptions that we have would still be in place. Medical exceptions already exist for those who cannot risk the vaccines currently available. And these are rare conditions. Religious exceptions exist for sincerely held religious beliefs that must be generally recognized as a tenet of an established religion. According to already existing policy, personal or political objections do not qualify for an exception to any vaccine requirement. Another important fact is that the vaccination status is officially considered a personal medical record. So I want to be clear that members of our UNCSA community cannot require another person, student, faculty, or staff member to share their vaccination status. They have to willingly volunteer their status. While UNC institutions are not currently permitted to mandate vaccinations, we do have the latitude from the system office to incentivize them in a variety of ways, such as the reentry testing exemption that I already mentioned earlier in the conversation. Additionally, a person that has chosen to confirm their vaccination status will not be required to participate in our weekly StarMed surveillance testing, and they will be permitted to opt out if they choose. Another incentive is that students that have chosen to confirm their vaccination status will not be required to quarantine if they turn up in the contact tracing of a positive case, unless, of course, they develop symptoms and test positive, and in that case, they still would have to quarantine. So now let's move on to our current masking protocol for campus. Based on the prevalence of the Delta variant and the studies of possible breakthrough infections, we have adjusted our mask guidance as of last week. Masks are now required indoors for all unvaccinated and vaccinated individuals. Similar to the spring semester, you may remove your mask for eating, drinking, or when employees are in their own walled spaces. Some instructional activities as approved by deans will be allowed to be done without masks, and President Sims will elaborate on this in a moment. Outdoor masking is not required. We are still planning to include live audiences for this year's performance season, and all patrons will be required to wear masks at all times while attending UNCSA performances and events. In terms of our campus environment, we will also be continuing to invest heavily in the mitigation measures that we had in the spring, including maintaining needed ventilation systems for the required air changeovers, the existing small air purifier systems that we have, additional cleaning shifts on campus, and continually restocking all of our sanitizer and wipe stations, which are prevalent in all of our buildings. Now let's move on again to the topic of testing. As was the case in January, reentry testing is required for all students, faculty, and staff before the start of the fall semester. However, as I mentioned previously, there is an exemption for those that have been vaccinated and choose to upload their vaccination cards. So if you're vaccinated and you have uploaded your proof of vaccination, you do not have to submit a negative COVID test to return to campus. Any new or returning high school students that choose not to upload vaccination proof are required to have a PCR COVID-19 test administered this Wednesday, August 4th or Thursday, August 5th, and that negative test must be submitted by noon on Monday, August 9th. Any new or returning college students that choose not to upload vaccination proof are required to have a PCR COVID-19 test administered Tuesday, August 10th or Wednesday, August 11th, and that test must be submitted from them by noon on Monday, August 16th. Again, these are the dates that we have already published in the communication to you. As I mentioned earlier, if you are still in the process of a 2-shot vaccination, then you still need to submit a negative test by your deadline and then share your vaccination card if you choose once you get your 2nd shot. Our in-person summer programs will continue as planned with masking indoors, and then employees and students of fall community programs will be required to submit proof of vaccination or a negative COVID test before their first lesson or class in the fall. Free testing is still available 3 times a week in Forsyth County, as well as most areas of the country, but any expenses incurred with testing will be the responsibility of the student or the employee at UNCSA. After the fall semester begins, any students, faculty, and staff that have chosen not to upload vaccination proof will be required to participate in the surveillance testing that we have weekly, which will be administered on campus again by StarMed, and this semester will be every Tuesday from 11 a.m. to 2 p.m. Vaccinated faculty, staff, and students will be permitted to opt out of surveillance testing if they wish. And like the spring, we will likely also have some capacity each week for others to sign up and be tested if they would like to be. So that is a summary of our health and safety protocols for the semester. I want to reiterate that we are monitoring the local, state, and national health situation on a daily basis, and we'll continue to working to be prepared to adapt our protocols should the situation change in either direction, whether we determine that there is an elevated risk or if the situation gets much better. The protocols that we have in place are for right now as we start the semester, and they may be the same at the end of the semester, or they could be revised based on changes in guidance we receive or changes in the public health situation. So our goal will be to maintain a clear and consistent level of communication with all of you and to be responsive to the needs of our campus and its people. And now it is my pleasure to introduce a very important leader on this campus and the person that is a trusted partner for me in everything that I do as chancellor. He's here to welcome you as well. And with some members of his team, we'll go through some student and residential life topics and questions, as well as the specific arts and academic planning that he has been working on with our deans. So now I'm going to turn things over to our Executive Vice Chancellor and Provost, Patrick J. Sims.
Thank you, Chancellor Cole. And again, welcome to everyone. And we're so glad that you're with us. And we hope that you will find this information incredibly useful for you as you kick off the beginning of the new academic year. As Chancellor Cole mentioned, I'll try to keep my remarks brief because I think in part you want to hear from the individuals, our deans and our vice provosts, who are working with their faculty and students directly on the ground in the classroom and in performance venues. But I'll say a little bit about the parameters that we're putting in place for safety precautions. You should note in the classroom, as Chancellor mentioned, everyone will be required to wear masks. However, we have elevated our ability to have air scrubbers and plastic dividers in the classroom space. So in those instances where individuals may need to remove their mask, if we think about students who play woodwind instruments, for example, vocalists, or individuals who may be taking foreign language requirements and the instructor needs to see how their mouths are moving or how they're making the certain sounds. There are those exceptions where individuals can remove the mask and engage in the activity. That said, other mitigation measures will still be in place. We've mentioned that we have several materials that are available around campus, lots of sanitizer, lots of hand wipes. Again, these dividers, the plexiglass dividers that can be used in the classroom. So there are a number of mitigation factors we put in place last year that we're still able to deploy this year. One of the key questions that comes up for us is the degree to which students and or faculty members will they be required to wear masks in the classroom regardless of vaccination status. And the answer is yes, for the time being. We want to make sure we're safe. And we're also mindful that for individuals who may not be able to get vaccinated, we're tracking their experiences as well. So no student, regardless of the vaccination status, will be penalized because of that vaccination status. And by that, I mean, when it comes to casting experiences for our students in drama, or we have assignments, whether they're part of the ensembles for our dance students, what have you, the condition of the vaccination status is not going to affect how that student might be able to engage in said activity. That said, if a student, for whatever reasons, falls ill or sick, and we find ourselves in a situation where we may have to replace that student, that's no different than what we would have done in prior times pre-COVID, where if your opening night is happening and your lead is sick, you put in the understudy. So those processes are still going to be in place for us as well. I'm going to ask Dr. Karen Barris to speak a little bit to our online experiences and faculty engagement and student expectations regarding online course engagement. Karen?
Thanks, Patrick. Just a few points that I want to add to what Patrick has already mentioned. We are planning with our faculty to return largely to pre-pandemic modes of delivery, which means we are going back to the in-person experience that we have so long excelled at. Knowing that we have learned lessons over the past year and that there will be hybrid elements that we're still going to be capturing in classes that proved to be effective in the classes last year. I will say that we have few fully online classes this year, some that have been offered fully online in the past, such as in our Collegiate Division of Liberal Arts. Will continue to be fully online, but we will not have a lot of options for students who are looking to potentially do a fully online education this fall. So in most cases, that is not going to be an option that is available to you. Our faculty are preparing to continue posting courses in Canvas, which is our learning management system, where students can access assignments, and faculty and our deans are aware of the potential need to keep students up to speed with what is happening in a class if and when we enter a quarantine circumstance with a student or students here at UNCSA. So we're looking forward to having everyone back safely in the classroom with the masks and taking care of our hand health, but knowing that we are largely going to be in person and back the way that we have been for so many years. Thanks.
Thank you, Karen. I'm going to ask now our Dean Martin Farrell. Dr. Farrell, if you wouldn't mind talking a little bit about the high school experience and protocol and how you're handling situations where students who may either miss class, or how are those things going to happen at the high school level?
Thank you, Patrick. Consistent with what Karen just said, we would support student absences as we have in the past, pre-pandemic, through the posting of course materials on Canvas and working with individual students during their sickness to make sure they have what they need to make up the work in a timely fashion. But we will not be providing like a Zoom in option to the class for absences this year, intending to return to the in-person experience.
Great, thank you. I will note that hybrid online instruction is actually one of the most complicated modalities to teach in, where you're having to teach a set of students who are physically in front of you and another students who may be engaging in the experience via remote experiences back home. I'm going to ask Dr. Green Rogers, our interim dean for Division of Liberal Arts, to talk a little bit about how her unit will be handling some of these situations, because we do know there are instances where we have some of the hybrid courses on the books already for us. Martine?
Thank you, Patrick. Hello, everyone. In the spirit of aligning with Dean Farrell over in the high school, we are following a very similar protocol in terms of how we are dealing with student illness in the Division of Liberal Arts. We do have quite a few selection of courses that were already scheduled to run either online or hybrid. Those will remain the same. And we will also be using our classroom management system in order to get information to students who are in face-to-face courses only, in order to keep them apprised of what is happening in class if they do need to come out as a result of quarantine and or sickness. Besides that, I would always suggest our students to talk to their professor and to talk to me if they need some help and some assistance as they are quarantining or need other additional support. And I look forward to interacting with everyone and hopefully I will not see anyone as a result of the Rona. Thanks.
Thank you, Martine. One question that comes to us is asking about, will students remain masked during performances? I'm going to ask Dr. David Winkleman to chime in, as well as Karen Lantz, speaking on behalf of music and drama in that order. David, you want to tackle that first one?
Thank you, Provost. In music, what we are planning is for those students who need to remove their mask, wind, brass students, for instance, of course, to remove masks during performances. Those students who do not need to remove their mask, as of now, and I'll echo something that you've been hearing throughout the conversation so far, this is for this moment, with the possibility of change as new information arises and is understood better. But for right now, if a student can perform while being masked, they will remain masked during the performance. Thank you.
Thank you, David. Karen?
Hi, everyone. Yes, so for our productions, we've already stated as a university that we're going to have the live audience and they're going to have the mask requirements. For performers, we're most likely not going to be masked, but we're going to proceed with the protocols that we had in place similar to our filming of last year. So we have all those protocols already in place. We've gone through how this is going to work to make sure that everyone is safe in the space during rehearsals and performances. And as David said, this is an ongoing change. As things may happen, we may adjust.
Great, thank you. Up next, I'm going to ask our Dean Indolin Taylor for dance and our Dean Deborah Levine for our School of Filmmaking. There are some unique parts that goes to their curriculum. So I want them to be able to speak to any of the unique parts of how they're going to be responding to classroom experiences, and in particular for film, how you're going to be handling what's happened when you might be on set or on location off of campus grounds. So I'll ask Indolin if you wouldn't mind going first, and then Deb afterwards.
Certainly, thank you. Yes, similarly to the other schools and deans, we will be practicing our good hand health, wearing masks for all of our classes. That includes our partnering classes, which will be coming back into the curriculum for this semester, and also during performances. In terms of the bars, we will continue to wipe them down, as well as the floor for our classes. But we will just be mindful of the fact that we are all here to work together and to experience the rigor that this program is known for in the best way possible in this moment in time.
I will add to Indolin, thank you for sharing that. Last year, we had the issue of proximity, where physical or social distancing, as it was referred to, was a major, major impact on the dance program. For some of our returning students, you may remember those 10-foot squares that you all had to stand in to dance safely. Well, we will be going back to sort of regular density in terms of our population, the number of students in classes. That approach that our dance program took last year, it impacted the entire calendar when classes were offered or how many times those classes could be offered. So we're going back to our regular setup. So you won't have that 10-foot box that you'll be dancing in, which is going to be key for us. But as many have said already, you'll still be masked and we'll still be engaging in all of the other safety protocols and measures we've described. Deb, you want to talk a little bit about what's happening in the world of filmmaking?
Yes, thank you, Patrick. And hello, everyone. I'm thrilled to be starting this process and adventure with everyone. I'll pick up on what Patrick was just mentioning about proximity. In film, our protocols are still evolving, but some of the protocols that we have established are that, as with every other school, you will be required to wear masks in the classroom and all indoor spaces, including the sound stages. However, there is an exception. When an actor is in front of the camera, they will be allowed to remove their mask after the camera is rolling. However, they will be expected to walk to their mark with their mask on. After the shot is finished and cut has been called, the mask must be replaced. This must happen between all takes. In terms of proximity, how close an actor can be in a scene, we're still working on this, and we ask you to give us another week or perhaps a little bit more, but we recognize that there's a lot of production that's happening very soon, and we're very keen to make sure our protocols are in place as soon as possible. There will not be any location shooting off of the UNCSA footprint. That is for now, and we will update you if that changes, but any productions that are in the pipeline for the near future must be shot on the footprint. I will also be having a meeting. It's not required, but I encourage you to join us on 11 Eastern time on Friday. We will send a Zoom out and we can drill deeper into our protocols at that time. Thank you so much.
Great, thank you, Deb. And last but not least, Dean Michael Kelly, who heads up our design and production school. Michael has his hands in almost all facets of production with our programs. So Michael's shop rarely shuts down. So Michael, you have to keep things humming. Talk to us a little bit about what's going to happen in the shops and how students are able to do what they need to do safely, both in terms of the protocols regarding COVID, but also just general safety regarding the types of work that they're going to be doing, work with power tools and those kinds of things. Michael, take it away.
Thank you. We are going to have very similar protocols that we had last year. We will be stepping back from a few of them, but very little. So we're going to have more density in the studios, in the classroom. We feel like it's not necessarily necessary to have the plastic dividing sheeting within the classrooms, but when it comes to the shop spaces and all classrooms, we require you to wash your hands, wear masks, and clean your power tools, just like we did last year. So it's going to be very similar to what we saw. So it should not be a big departure. What we did last year that was highly successful. So again, we're just continue doing and moving forward, and it's a line in the sand. As Patrick said, things could change in 3, 4, 5 weeks, but this is where we are right now.
Right. I will add also that institutionally, we have an additional set of cleaning services that will be offered for campus. And I know, Michael, your shop was one of the spaces that a separate cleaning crew came through to make sure they did extra cleanup. The students also wiped down and did all the things that they needed to do when they were first touching the equipment and then when they were completed with the equipment. So there were at least 2 cleaning opportunities before a new student touched a new piece of equipment. So I wanted to have each of the deans to walk through those processes with you. And Deb already sort of put the word out that she's going to have a follow-up meeting with faculty and staff and students this Friday. The other deans will likely have similar opportunities. So be on the lookout for information from your respective schools about what types of protocols, any deeper dives that need to be taken regarding what the classroom experience is going to be looking like and what performance is going to be looking like when we're back here in the fall. Okay, so I'm going to shift gears now. So we talked about the academic part, but there's that whole other part that deals with what happens when you're in the dorms and you have student life, student affairs. So I'm going to turn things over to Dr. Tracy Ford and her team, Laurel Donnelly and Steve Gallagher. And as Tracy mentioned, she's going to have to boogie in a little bit, but she's got 2 great folks who can answer any additional questions regarding the student affairs protocols. Tracy?
Thank you, Provost Sims. Sharon Summer is also available with us, who's the Director of Health Services, and she'll be providing some information today as well. I do want to address a few issues myself, and then I'm going to turn it over to Laurel and Sharon to provide you with more information. The first thing is related to the residence hall. Wanted to let you all know that we will have regular capacity, although we do have a few rooms that are available for quarantine, and Laurel will talk about that. But overall, we will have regular capacity in our residence halls. One of the questions that I've seen come up quite a bit is, whether or not students will be paired with, the vaccinated students will be paired with unvaccinated students. And the answer to that is we don't know the vaccine status of each individual student. That's part of the privacy for our students. That's the first part. The second part is that assignments were made well in advance of these particular community standards that we're discussing with you today. And also, when we sent out assignments, we did encourage roommates to have conversations. We didn't encourage them to ask each other their vaccinated status, but we did encourage them to have conversations about just regular dorm room safety. We have a roommate change process anyway that we've always had for any particular reason. So students will be able to submit a roommate change request if they prefer to do that. But I will say that not all requests will be accommodated. Just it's based on availability, it's based on circumstances. And so we would have to see how that goes. But as it stands now, very similar to our other UNC institutions, we are not making an effort to specifically room vaccinated students with vaccinated students or the other way around. So I did want to make sure I address that. But again, keep in mind, we have a regular roommate change process that you're welcome to utilize with the understanding that nothing is guaranteed in terms of a change. Move in, you all should have move in appointments and be getting ready for those of you who are residential students to move in. If you don't have an appointment, make sure you check your email, click on the link, sign up for an appointment. Students, in order to move in, you must be cleared, and clearing, as Chancellor Cole mentioned, is either submitting a vaccination card and or your reentry test during the time frame that we've asked for that. So you must meet that deadline. For those students who will be bringing helpers with them to move in, your helpers are not required to meet the vaccination or reentry test requirement, but what we are asking all of your helpers to do is to ask themselves safety questions around fevers or coughs or aches and pains. And if they have any symptoms, we ask that they not join you in moving in. Everyone will remain masked during move-in. That includes the student. So even though it's your residence room and any other time, you would be able to be in there unmasked. But because we'll have so many people in the residence hall moving in, your roommate may pop in, their family might pop in while you're moving in. We're asking that during the move-in process that everyone remain masked, including the student. That is during that time frame. When you are done with moving and families have left the building, you are welcome to be in your room unmasked. The only time, again, we would ask you to unmask other than move in is when you have guests in your room. Your roommate and you can be unmasked at all times, but if you have guests in your room, then you must wear a mask. And we do have limits on guests. So you will be allowed 2 guests per roommate. So if it's a 2-person room, that's 4, but that's not one person bringing all 4 of their friends. That's a conversation that roommates have to have with each other about how they want to spread those 4 people out. Some people will have 1, some people will have 2. But anyway, those are conversations you can have. We have staff in our residence halls that can help facilitate those conversations between roommates, because we do understand that sometimes having those conversations can be difficult. So if you want to have a conversation with your roommate and you're not quite sure how to have that conversation, please reach out to the staff in your residence hall so that they can help you have those conversations and help you set some safety standards within your own room. We are, let's see, 2 guest assignments. Yes. So in terms of student life, we will continue to have programs and activities on campus, and those will be at regular capacity. So during those inside events, of course, everyone will be masked. So in our outside events, there will be the opportunity to not have a mask, but we are encouraging people to wear your mask indoors or outdoors, whatever your comfort level is. In terms of off-campus and how the standards apply to off-campus students, we will not be holding students necessarily accountable for off-campus masking and at-home masking and what happens in your own residence off-campus. However, we are highly encouraging you to not have or attend large gatherings, especially where people are going to be unmasked. It's not something that we will monitor or police, but we are highly encouraging you to stay away from those large gatherings and having guests, large numbers of guests at your home. If you choose to do that, we're encouraging you again to stay masked when you have guests in your home, and to just take every safety precaution that you can when you are off campus in your off-campus residence. And I do want to say for the record, our apartments, the lofts, and center stage are on-campus facilities. So you will be held to the on-campus standards for health and safety when you are in the lofts, in our A through F, our high school residence halls, as well as center stage. These are the non-UNCSA residences where this does not apply. So just make sure that if you're in our apartments, know that that still applies to you. I'll say briefly, just really quick, our dining for the most part will be just about at our regular capacity. Last year we de-densified quite a bit, but although it's at regular capacity, we still have spaces within Haynes Commons where students can go there and eat if they want to spread out and have more space. We also will have the opportunity for you to take food out if that makes you comfortable as well. Because of course, in the dining hall, if people are eating and drinking, they are unmasked. So that would be a choice that you would have. And we've made a point to create some lounge space, some comfortable space throughout the building so that students will be able to have more space for that. Just a word about our community health standards. Chancellor Cole mentioned those so that many of our deans talked about this. And we do have conduct consequences for people who fail to meet our community health standards. Last year, we were very successful in our response to COVID and in the number of cases that we had of COVID. And so we want to continue with that success this year. One of the ways that we were able to make sure students were compliant is that we did develop a set of student community health standards that students had to follow. Those standards are being updated. We'll make sure you get a link. But in general, what I want to say is that, you know, you will still be able to report if you find people in violation of our community standards. Students will still be held accountable if you're in violation of our health and community standards. Keep in mind that when I say held accountable, our first response as educators is always to educate. We're always looking to find a way that even for students who violate our code of conduct, that we choose education first. And we work really hard to make education our first response to students who violate our code of conduct. However, we do have more severe sanctions depending on the action that students have engaged in. We also we have progressive standards. So if it's first time and then second time, third time, that kind of thing, those sanctions do tend to get more severe as we move forward. I'll stop for now because I do want you to hear from first our Director of Health Services, Sharon Summer, who's going to talk to you a bit about testing protocols and a few other health topics that you need to be made aware of as it relates to our COVID response. And then Laurel Donnelly, who is our director for our quarantine and isolation process, as well as our interim director for high school life and case manager. Yeah, lots of titles, but she gets it all done. We appreciate that. Laurel will then give you some details about if you find yourself in the process of having to be quarantined or isolated, what will happen with those steps. So Sharon and then Laurel, thank you. Sharon, you're muted, so if you could unmute, thank you.
Hi, everyone. I'll start by just talking a little bit about some of the specific protocols we have in student health services. And then I would like to share some information that I think will answer a lot of the questions that I've been seeing in the Q&A. However, first, regarding student health services, in order to keep all of our students and our health services staff safe during the pandemic, we'll be operating just like we did last year, and that's by appointment only. We will not have walk-ins. We cannot have that many people in our small lobby, and we also can't risk someone coming in unmasked that might be potentially infected with COVID. We will offer telehealth appointments as well as in-person appointments. There are a lot of things that we found through this pandemic that telehealth can meet needs, and students don't have to come into health services, for example, prescription refills and things like that. I will mention to all students that are on this call, if you experience any symptoms of COVID-19, fever, sore throat, runny nose, a new or worsening cough, shortness of breath, a new onset of nausea, vomiting or diarrhea that's not related to another medical condition, fatigue, headache, or muscle aches that are not related to another medical condition, do not attend class or any other campus activities. We want you to contact health services. We will put you in touch with one of our medical providers by phone. They will do a screen and determine if you need to come into student health services to be tested. With that being said, we do provide testing, COVID testing and student health services for students that are symptomatic. And by that, I mean, if you're sick with symptoms of COVID and our medical provider determines that you need to come in for testing, we can do that on site. And we have some very state-of-the-art technology that allows us to do a COVID, flu A and B, and RSV test all on one test. So we can rule out flu, COVID, and have those results back in 30 minutes. All students, of course, will need to be masked, covering their nose and mouth, and all the health services team will be masked, and our medical providers, if they're doing COVID testing, will have other personal protective equipment on, like face shields, N95 mask, gowns, and the testing, if you need to have testing, there's no cost to you for the testing. That's provided free of charge. And the other students that we would test in health services would be any student that has been identified as a close contact through a known exposure to someone that has a positive case of COVID. So if you've been contacted through a contact tracer, that you've been exposed to someone that has a positive case of COVID, we will bring you into health services 3 to 5 days after that exposure for testing. One thing that has changed with the CDC is the CDC is now saying that whether you're vaccinated or unvaccinated, if you have a known exposure to someone that has a positive case of COVID, you need to be tested 3 to 5 days after exposure. So we will be testing all known exposures to a positive case, whether you're vaccinated or unvaccinated. The protocols that are being followed regarding quarantine and isolation are following the CDC guidelines. And for anyone that has a positive case of COVID, that is still the same as it was last year. You have to isolate for 10 days. And if you're a known exposure to someone that has a positive case of COVID, if you're unvaccinated, you will have to quarantine for 14 days. If you're vaccinated, you will be tested, as I mentioned, 3 to 5 days after the exposure, but you won't have to quarantine if you're fully vaccinated. You will just watch for symptoms, and if symptoms develop, you would need to contact health services. Laurel will talk more about the quarantine and isolation process as it relates to student support during that time of quarantine and isolation. But I'll mention a little bit about the surveillance testing that we're doing weekly. We will have a vendor on site weekly, and as Chancellor Cole mentioned, on Tuesdays from 11 to 2. And all unvaccinated students, faculty, and staff will need to go through surveillance testing weekly. A couple of other things that I wanted to mention just about the new Delta variant, and just a couple of other things that I've seen in the chat as far as questions. One reason that we had to really, things were going great before the Delta variant. I mean, things were going great, and you saw that, things had opened up. If you're fully vaccinated, you didn't have to wear a mask, and it's still that way in a lot of places. But what we found out with the Delta variant is that it's more transmissible than any other variant so far. And according to the North Carolina Department of Health and Human Services, over 75% of the COVID tests from North Carolina in recent weeks are the Delta variant. With all that being said, the highest instant of transmission in North Carolina is in the 18 to 24-year-old group and 25 to 49-year-old age group. So that's our population here. And, the highest percent positivity is also in the younger age groups. And honestly, it's not because of breakthrough cases, it's because there's still a lot of unvaccinated people. That is what's caused some of this sudden surge since around July 4th. Just to make everyone feel a little bit more comfortable, and why we really are pushing vaccination is because, according to Dr. Zach Moore, he's an epidemiologist with the North Carolina Department of Health and Human Services. And he has said that almost all viral transmission is now in unvaccinated people. And from May 6th to June 28th, people who were not fully vaccinated accounted in North Carolina for 99.2% of all the COVID cases, 98.7% of the hospitalizations, and 98.9% of the COVID deaths. So Forsyth County happens to be one of the areas with what they define as substantial transmission. So wearing a mask in areas of high transmission is the responsible thing to do, because there are, as I mentioned, a lot of unvaccinated individuals across the country. And there's also individuals who are immunocompromised who are unable to receive the vaccine. Vaccine breakthrough is expected. There's no vaccine that is perfect. There will still be a small percentage of fully vaccinated people, as you have seen with some of the breakthrough cases. But out of 162 million plus people in the United States who have been fully vaccinated, the breakthrough cases represent less than 0.08%. What we do know is the COVID-19 vaccination is much more protective than the flu vaccine, which flu vaccine gives you about 60% protection most years. The COVID-19 vaccination is as much as 95% effective in preventing severe illness, hospitalizations, and death. And that is what our goal is to preserve life. If you're vaccinated and you happen to have a breakthrough case, most of the time, those cases have been very mild. It's very rare for a patient to have severe disease after full vaccination. So I'll just end by saying, the big takeaway from experts is that no vaccine can provide 100% protection, but the vaccine is very effective at preventing severe illness and death. And as Chancellor Cole said, we highly recommend that you get vaccinated for COVID if you're not already. And I'll finish with my remarks, and then Laurel, if you want to talk a little bit about the residential quarantine.
Yes, so as Sharon said, I'm Laurel, and I helped coordinate our quarantine process last year. I worked very closely with our staff and the contact tracers in the health center. And so we do have some spaces on campus reserved for quarantine. But what I want to make sure to tell everyone is that for anyone who is in that quarantine needs to quarantine or isolate by themselves, we are encouraging those students to go home if at all possible this year. The reason for that is that being in those rooms by themselves with no contact is very difficult and can be really hard. So for those individuals who do have to quarantine with us here on campus, we do have a process in place for that. And that process includes regular check-in phone calls and meal delivery service through our residence life staff who provide those meals to individuals on campus. We also, in terms of our office, in terms of student support and assistance, will work with faculty and really specifically with the deans directly on letting people know that students are out of class. And so what that looks like is in any given year, so we're not revealing anyone's status in terms of whether they have COVID or not, whether they don't have COVID. Our office in any year other than COVID would be working with deans directly when a student is out of class and missing class to make arrangements for that individual while they're out of class. So that will be the same this year as it was last year and any other year, and letting students and deans communicate directly on any missed assignments and getting those assignments to those students. We also have regular phone calls with those students to check in with them, and those students are also allowed the opportunity to do check-in phone calls via telehealth with our counseling center staff. What we have learned in the past year is that time in isolation and quarantine is really difficult for an individual. And we do our very best to provide the best support that we can, but knowing that, you know, it's not your home, you're not your home situation. And that is why we are really encouraging individuals to try to get home if at all possible during that time. And if not, we will have some spaces that we do have available here on campus in order to coordinate those efforts. And so I think that's kind of what I have to, and we can, we'll, I guess, open up for questions, I guess.
Thank you, Laurel. I did want to just emphasize, I didn't say this, but the visitors that are allowed in the residence hall are UNCSA students only. That these are not external visitors. These are not non-UNCSA students. They have to be a UNCSA student in order to be in the residence hall. And you will follow the visitation guidelines for that particular residence hall. At the beginning of every semester, the RAs, resident assistants, as well as the staff have meetings on the hall to go over what the rules are. So you'll hear more about that once you arrive. Thank you. And that's it for student affairs at this point. Thank you.
Chancellor Cole, I believe that we do still have a few questions in the Q&A. We are at time. I don't know if we are able to extend for a little bit.
Yeah, we've been able to address a lot of the questions along the way as we've been monitoring going through, but we'll extend a little bit more and catch a few more. So if you want to start feeling those, Claire.
Yes, as the questions have come in, there have been several questions about requiring negative tests for vaccinated individuals. And so I don't know if you and perhaps Sharon could elaborate a little bit more on why we're requiring negative tests for unvaccinated and not vaccinated.
Would you like to feel that, Sharon, or would you like me to take it?
I will, yes. As I said, the breakthrough cases, and this was a university decision, not my decision, not health services decision, but a university decision, less than 1% of cases are breakthrough. So it was felt that if you're fully vaccinated, there's no need to do reentry testing. But if you're not fully vaccinated, the university is requiring a reentry negative COVID PCR test before arrival to campus.
There seem to be a lot of music students in the audience that really need to know about how they'll reserve practice rooms, the vocal programs. So David Winkleman, if you could just assure them how those operations will happen.
Absolutely. similar to last year, there will be blocks of rooms grouped into pods for types of instruments. For instance, there will be brass rooms, there will be woodwind rooms, there will be violin rooms, and so on. What will be different than last year is that rather than 2 or maybe 3 rooms per studio, it will be a larger group of 6, 7 rooms for either the department or a larger group of students. And our hope is that we'll find a good middle ground between having known safe practice spaces, but with greater flexibility for you to be able to mesh your practice schedule with your class schedule, with your homework requirements, and so on. In addition, we have identified 5 practice rooms that will be general use, available for anyone to grab for an hour, no more than an hour and a half, to use to warm up before a lesson. If there's a little bit of last minute work that needs to happen, preparing for a keyboard skills class, to finish a theory assignment. So we've tried to take the good things that we learned from last year with having assigned practice spaces, but modify it to make it more flexible and more useful for you.
Thank you. And also a couple questions about the high school voice program.
Sure. This year, our plan is to return to cantata singers as a single large group. Mr. Jamie Albritton will be the director of it, and go back to rehearsal 4 days a week, Monday, Tuesday, Thursday, Friday, in the typical afternoon time slot of 3:45 to 4:45. That said, some of you will perhaps enjoy this. Most of you will probably groan, but we will be using singers' masks once again for during that rehearsal time. So once again, trying to find a way of moving forward toward more of what is typical while still balancing out with the ever-changing situation, especially with Delta.
Thank you, David. Tracy and or Laurel, a couple questions in the Q&A about mental health resources and what will be available to students this semester.
Yes, I'm happy to help with that question. We have, the Chancellor and the Provost have allocated some additional funds to help us increase our mental health support for this year. So that includes both one-on-one therapy and some additional group therapy. So there will be some one-on-one individual appointments offered through our counseling center. In addition to that, we'll also be offering some more group opportunities for students to have increased support for our students with mental health.
Okay, all right. How about, there's another question, Tracy, about the dorms and if they've been deep cleaned over the summer. You mentioned cleaning protocols already, but if you'll address specific deep cleaning.
Yes, thank you. Yes, the residence halls have been deep cleaned. We're still in the process of going through and touching up things. So if you do arrive and you have any issues or concerns, please alert a staff member. But our plan is to go in, and we're doing it now, inspecting every single residence halls, laying eyes on it, and making sure that everything is in place for your arrival.
Chancellor Cole, there are a couple more questions that we could answer if you want to take time. I don't know how much more time we have.
Well, we should probably wrap up there, just to be respectful of time, because I know a lot of people are taking time out of their day from work to do this. As Claire mentioned, we were able to get through quite a bit in process, because we had all the people on the screen monitoring the Q&A and jumping in their presentations. So, but there are still a handful that we didn't. We will, as Claire mentioned, be putting those topics and making sure they're integrated into the website. And so look for those information. Also, as Provost Sims mentioned, there will be individual breakout sessions focusing on the different art schools. Just keep on the lookout for information from your deans That'll be the chance to ask more questions, specifically going into more detail as they started to do in terms of what the classroom and the studio and the stage and all, and that's all gonna look like and what to be ready for. So I want to thank everybody that's on our panel today for not just being a part of today, but certainly for all the work you're doing to support all the other people that are tuned into this. And that's why we're all here. We know you're really excited about coming back or arriving for the first time. We couldn't be more excited that you are, because this place, it's not just that it isn't the same without you, this place doesn't exist without you. You're the reason all of our students that we exist and why we're here. So we're committed to fulfilling our mission and giving you all the training and providing the development. That's the reason you're coming here. And we're committed to doing everything we can to do that safely and protecting this community. So that's our commitment. As Claire mentioned at the top, this session has been recorded and we will be uploading that to the website. So for anybody that wants to go back and review any of this information, or certainly if there are friends or colleagues that were not able to join, please let them know. But thank you again for joining us. We hope to see you in person very soon.